today's HealthCast, experts are learning about how COVID-19 has been especially dangerous for people with underlying medical issues such as heart disease, diabetes, or respiratory issues. But another study from the UK found that the most common pre-existing condition leading to death was actually dementia. Dr. Damon Salzman is with the Cleveland Clinic Weston, and he says there are multiple factors which play into that grim outlook for people who have dementia who are infected with the virus.
People with dementia very often require additional services. They very often require additional social communications. They require different assistance. And because of concerns about either infecting the people who are elderly with dementia or just simply fears regarding infection in general, many of these services have been extremely limited or even closed.
So Dr. Salzman says the isolation and the lack of access can mean a lot of complications develop and are not addressed until it's too late to actually do anything about it. He encourages friends and family members to be vigilant about daily contact, either in person or virtually, to detect potential problems very early on. And there's a lot of buzz right now about an anti-parasitic drug called ivermectin. It's been used off-label to treat COVID-19. Now, when researchers in Australia found it could actually inhibit this virus in cell cultures, and those findings quickly circulated, and some doctors started actually using it off-label already as a treatment, even though it hasn't been studied in humans. This particular drug has been used to treat other viruses, including the Zika and dengue fever.